things we're talking about today, in all honesty, the first day you show up for a job, they're gonna hand you like some forms and stuff, and you have to make these decisions. And a lot of times you don't know a lot of what they're about, okay? Health insurance now in the United States is a requirement, all right? Since the Obamacare, not trying to make any political statements, but it's now required of everybody to have some sort of health insurance. So if not, you have to pay extra tax, I think. I'm not real sure how that works. I'm just going to talk a little bit about what I know. Do I know everything about this stuff? No. Okay, but I'm going to try to just give you some ideas so you can make a better decision when it comes time for you to choose something. So first off, now these are 2014-15 rates because that's just what I had. They don't have the rates for the current year out. I will say this, all these rates have gone up since this time, all right? And some of them quite drastically. But the idea will be the same. Everybody got that about what's behind them, so that's not. And usually we have like 3 types of plans, okay? So maybe need to erase a little bit of my stuff right there too. All right. This one here cost you the least. So obviously it probably has the least number of benefits. This would be the middle one. This will be the one that cost you the most, all right? So here we go. This is like for an employee only, like with the district here. This is what the cost is, right?
This is per month?
Per month. Yes, this is per month. Yes, all right? And look at employee spouse. Huge difference, all right? Now look at employee children. A lot less than like right here. Why do you think employee children cost less than employee spouse?
Probably like to make sure, because you have a family, they want to limit expenses.
Well, first off, children usually have like sickness, the doctor's appointments, medicine, but a lot of children don't have the strokes, heart attacks, all right? Older people, when they get older do, and if they're not older, they're younger, what can women have happened to them, especially if they're young and married, not young married, but young children?
Yeah.
Hospitalization, those are things that cost a lot. And look at the employee family cost. All right? And like I said, these are 2014, 2015 rates. Yeah, like for a family, like you're looking already at like more than $1,100 a month for insurance. All right? So that, I want to talk about like what these benefits give to you as you look at these things. Now I will say this here, I think where I particularly work at here, San Marcos, like they pay $325. So basically that would make mine, like if I just get this one only, free. All right, so let's talk about what they mean. The difference between the plans, because we saw what the costs are, but what's the benefits, right? Okay. The deductible on this plan here is $2,500. You're going to pay the first $2,500. This one $1,200 and that one $1,000. Okay. Also, though, but if you have an employee and family, you're going to pay the first $5,000. Although, if one person occurs, the $5,000 is still just stopped at 20. There's a one person particularly limit, but the whole family can go up to that. Here's $3,600 and there's $3,000. Okay. Now. But here's the thing, after you reach the deductible, you pay 20% of the deduct. Like say you have $10,000. Like say just me individually. I'll be honest with you. I had a procedure not too long ago. Outpatient. We'll say 20,000. That's not what it costs, but we'll just say 20,000.
Yeah.
Well, I have to pay the first 2,500.
Okay.
And then you take that 20,000 minus 2,500, and then I pay 20% of it until I get to what they call a maximum out of pocket. Now here they have copay. And what this means is if you were to go to the doctor, you're only going to pay $30 to go to the doctor, $60 if it's a specialist, here $30 and $50. Here you're going to pay, like when I go to the doctor, my heart doctor, I pay the total. Now insurance companies still negotiate a deal. I think if I didn't have any insurance at all, it would probably cost $200 to $300 for the one visit. But the insurance companies will even negotiate with doctors and say, well, we'll pay, like you get a special price. My price for my doctor on this plan here is $161, which I have to see twice a year. All right? So I know I'm paying $161, you know what I'm saying, but, all right? But here's the maximum out of pocket, $6,350. So remember that procedure I said that cost $20,000? I pay the first $2,500, then I pay 20% of that 17,500, which is around $3,500, which will put me right at $6,000, pretty close to what, being over. Then if I have another procedure that year, I may only have to pay the $350, and insurance covers everything else. That's the most I have to pay. I got it? Like, if I was to have really bad stuff where I have a $100,000 hospital bill, this is what my out-of-pocket, the insurance picks up everything after that amount.
Yeah.
Okay? But for employee family, it's this amount on this plan. Here's what they are, you know what I'm saying, on those plans. This is the low plan, this is the plan that you spend the least amount of money on, the middle amount, all right, least amount. So let's talk about this here. This is the actual cost for an employee of this particular district, okay? Because they pay $325 of it, at least in this particular year. It might be a little mean. Kind of see what you're talking about here, right? So this is what you would actually have to pay per month for insurance for whichever one of these plans that you happen to pick. And that's what's going to happen to you when you go to your first job. They're going to say, which one do you want? They're going to kind of hand you a little thing like that paper that may have kind of like some of that information I had on it with a little more, but that was kind of the main part of it, yes.
That HD, does that stand for health and dental?
No, that's just high deductible, I think. I think that's what, I'm not 100% sure I think it's, but it's not. Dental is a totally different plan. We'll talk about that in a minute, all right? Now, let's talk about what happens, okay? Suppose I talk about, like, I go to the doctor, it costs me what? I go twice a year, so I pay that, right? Let's say I have an emergency room visit at $500. Now let's say I just go in, they don't do anything, it doesn't cost any more. I just kind of, like, it's going to cost more, but usually it's going to be $500 just to even walk into the emergency room, right? My total bill is $822. Same thing now, on this care here, we're paying $125 a month though. So that means I pay $1,500 for the year, but my doctor visit only cost me $30. I go twice, it'd be $60. My emergency room visit, because of the deductible plan, which I didn't talk about, like it's only $150 instead of $500, not counting the extra. So the total here though, I paid for the year, if that's all I do is $1,710, whereas here it was what, only what, $822. However though, I want to say this here, especially like with a family, if you have little kids, they have to have a lot of shots, a lot of doctors, like these amounts could go, talk about the family deal in a second. But, you know, like, I'm not trying to say one's always better than the other, but things to look at about your actual cost, got it? And here, same thing with this plan here, the doctor visits, right, and your deductibles, these kind of tend to be the same on this particular item that happened here, all right? Now though, let's talk about, like right here. I paid $822 for the year, right? So I have this much more of my deductible to meet that I have to pay first off, right? But then suppose I have a major surgery of $30,000, all right? So I take $30,000 minus $1,678 because I still have to pay that amount first right off. Now I'm going to pay 20% of that, which is this amount right here, but I only actually have to pay this much because this amount went over, put me over the $6,350. So if it was $40,000, $100,000, I still wouldn't pay more than that. That was my actual cost for the entire year if I had this particular thing happen to me. And I want to tell you what, this is not, that's pretty cheap for a major surgery. Just an outpatient procedure alone, I know people that had a $30,000 bill for an outpatient, all right? And so those that happen. Okay, on this plan here, the deductible is $1,200. You've only paid $210 of it, so you have $990 left to meet it. So the same thing happens. So that means my bill now is really this year because I had to pay $990 to get to the deductible. I'm going to pay 20% of that, all right? But the actual, because this is over my limit to the deductible, all right? I only have to pay that much. But here's the real kicker, everybody. I paid still though what, $125 for what? 12 months, which is $1,500, which I added that $6,350 for my total out of pocket. I end up actually paying what?
So
I paid more because I had to be, you know what I'm saying? This is here. This is the part people don't realize. They think just because, well, this is the deal here, it's going to cost me the most. Depends on what happens. Now, if you're going to get your out-of-pocket anyway, you actually pay you can save yourself $1,300, but yet it costs $1,500 more to, like, you know what I'm saying, to have the insurance to save $1,300. That's if you get there. And this one over here, same thing. Now, the 1,000, we still have 210, we have 790, which basically means I have to pay the first 790 on this plan. That's what's left, but I only have to pay that much due to the limit, I think being $6,000 for the maximum out of pocket there. But that plan cost me $240 a month times 12, so another 28. So that plan actually ended up costing me that. If that's what happens. So I wanted everyone to be aware of what this particular happens here on these insurance. So when you pick one, think of it. Now, I am going to say this. They take this money out every month. You know what I'm saying? You don't really see it in your paycheck. You don't really notice it, I guess, in like a real world sense. And then if you go to the doctor, you only have to pay like $30.
Yeah.
And if you go to the doctor a lot, that's a huge benefit. But me, I only go twice a year. Depending on what your needs are, it varies on what you need, all right? But you're going to have to pick one of those, all right? But be aware, you may have higher cost up front here, all right? But if you have real bad stuff happen all the time, which one still was the cheapest then? So, all right? Now, that was employee only, right? Let's look at a family, kind of the same situation. It's going to cost $820 a month or that much a year. If you go to the doctor, say 8 times, you know what I'm saying? It's going to cost you that. Emergency for $500 here. That's what I'm going to end up paying. $11,620 to the doctor 8 times and 1 emergency room visit. Same thing over here, $913 a month. That's that much a year. Same doctor visits. So notice this time it's a little bit what? Cheaper. And then here's the other plan. 8 doctor visits. Okay. This one's turned out to be a little bit more because the premiums are a little bit more for the month. Yes?
Should that be $15,000?
Probably for the year. I know, yes, probably not. I don't know what it is. It should be, that is not correct. I don't know what the number is. What's 998 times 12? That's what it should be. What is it? 998 times 12?
$11,976.
$11,976, which I probably have figured in here, just didn't put it in that PowerPoint right there. All right, thank you. So, yeah, that should be $11,976, because those numbers would, I think, add up pretty close to that right there. So, all right, let me change that in a second. All right, now, doing the same thing we just talked about there, about the deductible left, you know, given all those plans, because now you're on a family plan, could be different people. There's your total cost for the year in that plan. And then I still owe another what, $2,054 to get to my maximum out of pocket, which means I need that much more medical expenses to make that, make that right part. That. And then here's the same thing here with this plan, what it would cost, deductible, what you have left to meet, pay there, the 913 times, I know what's going to happen here, and this will be the other plan right here. And I probably should have had, that number should have put up a little sooner, I just kind of added these later. This is the actual total cost for each of the 3 plans for the family given the things that we talked about happening right here. Okay? Just kind of want you to look at what the costs are on those, all right? So.